I'd like to call the meeting to order for October 10th, 2018. And at first, I'll read our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promotes recovery, community participation, self-sufficiency, and independence. Adoption of the agenda, please.
So moved. Support.
All in favor?
Aye.
Against? Motion passed. Hearing of the public. Anybody would like to come up and talk to the commissioners? Public participation? Seeing none? We'll go on.
Madam Chair,
Yes.
just I was going to point this out at the time of the agenda and I forgot. Today is World Mental Health Day. So I think it would be nice just to acknowledge that as we participate in this meeting tonight.
Okay. I didn't know. Thank you. Thank you. Number 4, request to approve. Request to approve a request for proposal PFP for the Medicaid and non-Medicaid billing verification audit. That's A.
Support.
Moved and supported. Any questions? All in favor?
Aye.
Aye.
Motion passed. No votes? There's no votes. B, request to approve the FY 2019 contract amendment number 1 between Michigan Department of Health and Human Services and Macomb County Community Mental Health for Medicaid management specialty supports and service concurred 1915 BC waiver program, the Healthy Michigan Program, and Substance Use Disordered Community Grant Program.
Support.
Questions?
Yeah, Madam Chair.
Yes.
I'm sorry, I should have indicated on the software. Could we just have a brief overview of what these amendments mean, if there's anything significant from any significant changes?
Certainly.
Yep, thank you. Be more than pleased to answer some of your questions. We have an existing PIHP contract in place, and as you are aware, Macomb County, Kimberly Cope negotiates Macomb's interest with all the other PIHPs and the department relative to the PIHP contract, and that's been ongoing. So you already have an existing contract in place that was signed, I believe, back in, I'm going to say almost July or August. It was really early. And so what the department has done through their ongoing negotiation process is bring up the contract up to speed with amendments that may have been placeholders and they hadn't gotten to yet and discussed. So the first change to the contract is really section 7.8.2.6, and it speaks about programs with community mental health and inpatient hospitals. It really talks about who determines the eligibility for inpatient hospitalization, and it's only related to the factor that's tied into the monies that the department pays the hospitals for taking presumably more difficult children. There's a hospital rate adjuster and HRA, and so I think they're just solidifying, the department solidifying their position that they actually determine who they're going to pay an HR factor for and who they're not going to pay an HR factor for. And then if you turn, I don't know what page you guys are on, but in the very front of this attachment, you don't have to read through the whole attachment, just in the very front of it is a standard consent form that also, oops, that's another item.
What page is it?
Let's see if I can help out here. Excuse me, just a sec. Because I'm looking at the paper copy. I apologize.
So am I.
So on your screen, there's not even a page number on it neither.
On the top right in the blue bar shows page numbers.
Okay, so page 4, thank you. You'll see hospital eligibility is determined by the department. That was added. And then the department also wants to implement and use a standard consent form that helps streamline the business. That's on page 5. It's a more conducive way to be able to share healthcare records for purposes of payment, treatment, coordination of care. And then the policies that also support the use of standard consent. So that's on page 5. That's been modified. You can see that. And then if you look at the page 5 again, the section 8.4.2 contract withholds. It's a risk-based contract, but it's also a performance-based contract in some regards as well too. And our performance indicators aren't on here, but when it comes to our data reporting that we have to provide to the department. So if you're following me, 8.4.2, 0.04% for timely submission of projection financial status report. So every time the CFO submits a financial status report, there's a withhold that if we don't submit that withhold on time, then they're going to keep their withhold that they already have. They won't give us those monies. So to put a dollar value on that 0.04%, that's worth $59,000. If you don't submit that document, if the CFO doesn't submit that document on the date indicated, that's a $59,000 bill. Pretty stiff. Same with the rest of them, 2, 3, 4, 5. Those are all 0.04% timely submission, and a price tag of $59,000 if you don't do it. So the total on the withhold for this contract is $295,000. So you have our assurance that we'll make sure we do timely submissions of all these data reports, and we'll then retain those $295,000. The next one is the performance bonus incentive pool, and that's 8.4.2.1. So it's a withhold and also metrics as well too. And if you drop down to section B, where it says 0.075%, PBIP is performance-based indicator plan, or I'm sorry, performance-based incentive plan. So the withholds there, the Medicaid health plan, the PIHP joint metrics section, section, that's worth $383,000. The PIHP narrative reports are worth $950,000, and the PIHP pay for performance measures are worth $85,000. So that metric pool is equal to $1,417,581. So we have to make sure we meet those metrics as well too. This isn't nothing new to us. It's just they may have changed the amounts a little bit, but it's nothing new to us. We did it last year. We did pretty well on it, matter of fact. Then the next section on page 6. So I just got to get to my screen here. So on page 16, Once you find yourself there, on page 16, it says insert Milliman rate certification letter for the time period of the contract. So that's all included in the back of your contract. So for October 1st through 2018 through September 30th, 2019, they provided us the rates for which they're going to pay us for Medicaid covered services. And the CFO is going to provide an update on that in a few minutes. Insert section 428. 428 of the agreement is the drawdown. The county, we asked the county, Macomb County proper, for $1.9 million for drawdown. And when you give the state that money, we don't keep it. When we get the money from the county, we give that money to the state, and then that allows us to draw down the general fund dollars. So where it says insert section 428, that's really the $1.9 million roughly that we're going to provide the department to draw down the general fund dollars. And then the rest of it, pages 17 through the end, are really the Milliman report and the specificity that really speaks to all of the different rates and how they're calculated and how they're derived at. I would, again, draw your attention to those, how it's done. It's not easy math. There's a lot of decimals in there. But that's just the way our healthcare system is. And then the contract itself actually provides us with about $1 million more than we had last year. So Cindy, when she gets back in here, she's going to report out on something that's a little bit more palatable to understand when it comes to all of the funding for us. So I'd encourage the board to approve the PIHP contract, and then again be mindful too that the monies that you're going to receive, it's a different world we live in. The monies you're receiving are from now until December 31st, and they'll let you know what you're going to get in January. You used to know for a whole year in advance. You just don't know it anymore. And I think that pretty much summarizes it.
Well, what is the purpose of that? I mean, is it an accounting situation that? What is the purpose of, you said they didn't used to do it that way and now they have. Is it just with the PIHP configuration, or what's the purpose other than to really make it bad for everybody?
It's a great question. I believe it's, the department's ongoing attention to being able to look at what revenues that they have and what types of measurables that they're going to use to decide who gets what money. And I think it's constantly changing. Like, we've long known about the historical factor that, predicated our cost of services, and the historical factor is no longer a predictor of our funding. And I think then they're using other funding formulas. I don't know, Kimberly, do you have another explanation or reason why in the negotiations that they only give us 90 days of rates and they're subject to change in January? Are you familiar with that in the discussion?
No, they don't generally discuss the finance portion in the contract negotiation portion.
Okay, thank you.
Sorry.
I can ask that question and give you a better answer sometime. I can't do it right now.
I would like to know why it changed.
Okay.
Any other questions for the director? Seeing none, we need a vote. All in favor?
Aye.
Against? Be passed. I'll go to C. Request to approve extension of the AFIA contract for report writing services. Questions? Can I have a motion?
Move to approve the request.
This is a data reporting contract that provides support to our IS department in pulling the various reports that are needed on a day-to-day basis, both for day-to-day operations as well as reporting to the state. They support our internal data reporting capacity.
Motion, but no support. I'll support it. Thank you. Any questions? Seeing none, all in favor?
Aye.
Against? Motion passed. We have a receive and file. Receive and file revenue projects update. I have a motion. Somebody going to support it?
Support.
Lou and Doctor.
I'd like to talk about it too.
We'll have a couple words from our executive.
I think maybe something is, my CFO was gonna report on this, and maybe there's something going on, is more.
Yeah, John, just for your information, I got a text from Cindy. She has an emergency that came up. She had to leave.
That's what I figured. So I'm gonna report this out. Cindy and I met on it just a little bit ago, so I'm pretty well versed on what it's all about. And I can't find it on the screen. When I look at just be patient with this. I see the memo, revenue projection update, I see the memo, but I don't see, oh, there it is. So it's on under this item, it's on page 2. Okay. And if you're working from a paper document, it's on page 121, okay? So I'm gonna let you take a few minutes to find your way there. In the paper document,
The back of it, Lou.
and this is on a page 121. Yep.
Madam Chair, while they're finding it, and then it's sideways, so if you flip the fourth icon from the left is a little arrow thing, a little curvy arrow. If you hit that 3 times, it will present itself in a horizontal landscape fashion.
Okay,
So is
thank you.
everybody there? All right, so the first thing I want to talk about, this is the usual and standard reporting instrument that Cindy or the CFO has used in the past. This is not about the Internal Services Fund. This is just simply revenue and expense, okay? And the reason it's being brought to you is because you just approved the contract and the Milliman report that added in the revenues for us for 2019, at least known for October, November, and December. And so Cindy created a familiar form for you to be able to follow along and see what our revenues and expenses look like. It's going to be very telling, and you're probably going to want to have some discussion after this. But this is not about the Internal Services Fund. It's not about the financial risk management or the FSR that we're going to submit in November next month. So if you look at quickly on page 2, everybody there? So in 15-16, we actually brought in $185 million in revenue. And then in expenses, it was $181 million. So you got $4.3 million that we actually were to the good, okay? And that was largely because there was such an increase in Medicaid enrollment, even though we were reduced funds during that year due to rebasing, we actually made out all right because there was such an increase in Medicaid enrollment. So then 16, 17, these are actuals. You can see our revenue dropped from 185 million to 148 million and change. And then our expenses also dropped to 164 million. So we cut a lot of services, we laid off staff and did those types of things. Not laid them off, but through attrition, didn't refill positions. So projecting our current year, this is just straight Medicaid. Nothing that doesn't have Healthy Michigan in it, just straight Medicaid. So our current year, we're projecting to have $168 million. That's up $20 million, right? But as we reported out last month to you, that's all related to, or the majority of that is related to autism, because autism went from a fee-for-service to a capitated arrangement. So we got all these monies, and we're going to spend all those monies. In our expenses, were 181 million. So last year, on the Medicaid side, we overspent $13 million. And we reported out repeatedly to the board that we've moved Healthy Michigan dollars around to cover some of those costs. We had internal services fund in the past to cover some of those costs. And we've been able to come out favorably so solvent by moving monies around. So now, then we won't know for 17-18, we won't know how we close out until the year ended, right? The year ended September 30th. We will not know how we close out this year, last year, 2018, until February 28th. That's the date we close out. It takes a while for inpatient claims to come in, because we're still paying for people who are looking for, other payers before they bill us as the payer of last resort. So we think that when we're done with 17-18, that we'll have overspent $13 million. And now, that's just on the Medicaid side, revenue to expense. And then for 18-19 projected, we haven't done enough. And that's why I think the chair and some of us want to call some work groups together. How do we correct for the upside down, if you will, revenue to expense, where we can't close the gap on the $13 million. So on October 1st, unless I can sit here and tell you proof positive that we did something different, pretty much all of those dollars in the negative revenue to expense report are going to carry over to next year. I mean, this current year that we're in. So we're projected to have $12.8 million more in expenses than we are in revenue. And then if you go to
Madam
Commissioner Vosberg.
Thank you. So this projected for 18-19, that's if we do nothing different than what we're doing now, correct?
Correct. So if you turn the page, okay.
And it also is if we don't get a big increase when they give us new rates in January. It's current rates. Is there any chance we might get higher rates because we've asked, because they know our situation?
I don't believe that, they're all actually sound, through Milliman, they're certified by CMS. I don't know what is going to be those denominators that are going to push our rates up higher than other people's rates.
Okay.
I'd like to answer that, but I don't know that right now. I don't know that exists. I wouldn't expect the influx of monies though. So if you go on to the next page, page 3, this is your Healthy Michigan plan, and this is in the usual and typical format that you've seen in the past. And I'm going to skip 15, 16. You can see how it's gone down from, 27 million, 24 million, 19 million, 21 million, okay? Our expenses are 17 million. I went through that pretty quick. But in 18-19, we're projecting to have $21 million in Healthy Michigan plan and $17 million in expenses. So it leaves us $4 million favorable. So if you go to the next page, and this is where you kind of summarize it and wrap it up, because you can interchangeably manage your budget on Medicaid and Healthy Michigan Plan. We've had that discussion over and over. So on page 4, you can see back in 15-16, we had $213 million in revenue. Then in 16-17, it went down to 173. Then it went up a little bit, 188, and it had the autism services in there. And now it's up a little bit more, and feel good about that, the 189. So we picked up about $1 million in our 2019 rates. So Commissioner, or board member Linda Bush, the added monies that we received this quarter are $1 million more than we received last year at this time. The concerning part is if you look at that, you have $189 million in revenue, and you have a projected $197 million in expenses. So this is combining Medicaid and Healthy Michigan. So where you're really over in the Medicaid, $12 million overspent in the Medicaid, you're $4 million underspent in Healthy Michigan. And so you have $8.7 million deficit. And that's the gap we need to close. So the board was pretty progressive, along with the administration, in being able to bring to you a plan to reduce, not that we want to do that on the backs of our consumers, but to reduce the B3 respite benefit, to bring it in line with everybody else. So that'll pick us up some monies. But we have to correct for that $8.7 million where we still have more expenses than we do revenues. So I think it's attainable, and I think we can get there. We just have to continually to stay at it. And I think prior to the close of the meeting tonight, we're going to probably schedule some finance meetings and discuss how better we can make sure we have a balanced budget for the remainder of the year. Any questions?
Looking at these numbers are very concerning, because last year we were given money from the state. We can't really anticipate that happening. These are very large deficits. How long before the state comes in and says, you're not going to be able to do what you're supposed to do for your consumers?
I think they're going to probably do that in January.
Okay.
But I may as well speak to it now. I think the board and the administration have some busy work that we need to do to be able to correct for the revenue to the expenses. I think, and we talked about it before, we can do some legislative lobbying, see if the legislature's going to throw in anything or not. We've been there a couple times to the well. We got some money. It's a hard get. I think it's incumbent upon us to have a discussion with the department. And I've arranged for a meeting with the department for October 29th. And I plan to go to Lansing. I'll take Cindy Mack with me. We'll go and talk about the administration there at the department is all different than the people that you're familiar with. So if you go to the board conference, you probably won't see too many people from the department you're familiar with because they've all left. Mm-hmm. And I want them to know Macomb's story. And I have every intent to go up there on the 29th and remind them all, or if they don't know, tell them for the first time what happened in Macomb County and the ripple effect that is going to go on for years here when you take an agency of our size and you gut it by 17%. And I also need to be able to tell them, and I'm not going to throw us under the bus, but I also need to tell them that I think we're going to be challenged to manage our share of the risk this year, because conceivably you could be broke next year with no ISF, because it's been 15 million, 50 million, now 10 million last year, and now it's $2.9 million. Your ISF is dwindling away. And the department knows that too, because there's 3 or 4 other PIHPs that are kind of in similar situations as us. But I think the prudent thing to do is to go to the department, discuss with them, and I'm going to do that on the 29th, and explain to them our situation, ask for technical assistance, technical advisory, any way they can help us continue to serve the people in Macomb County. And I'm worried that, when we write our strategy on December 15th, we have to write a financial risk management strategy to the department. If we don't get it exactly right, I'm worried how the department's going to respond to that.
Is there a possibility that they'll end up putting somebody in place to help us manage?
I think there's probably a few things that could happen. One is that they could bring somebody in to, as that's what they did with Lakeshore. They pretty much told them, you know, you give us a plan in 30 days or else.
Correct.
And so I think you could find an emergency management situation here as one, good or bad. I think you could find that. I also think that, I think there's still opportunity for this board to consider private-public partnership, as much as that, you know, kind of raises the hair on the back of your neck. You know, it's working, or maybe, I don't know if it's working, I shouldn't say that. That's what Lakeshore Regional Entity did. You may need to find somebody that's got a deeper pocket and come in here and help shore up your ISF. You know, the third thing that is potential is, you know, you have, you know, a private or another PIHP come in and you know, nuzzle in on your MCO, your managed care organization functions here. So I think your point is spot on, Selena, that we need to get those meetings going really quick and decide how we're going to even write into our financial risk management strategy, something that may not be familiar with us or to us in the past. Otherwise, I'm afraid that, and I'm not being an alarmist, just a realist, I'm afraid that the department may come in and say, okay, you got 30 days to fix it. And I think you ought to be ahead of the curve when they tell you that.
John, do you think that if we went PIHP alone, do you think if we would have joined with St. Clair at the beginning, we wouldn't be in this situation? I know, because we went alone.
I don't, it's a good question too. I'm glad you have that history. You know, I can say it over and over and over again that you know, I don't know if I'm making you mad by saying so, but when the department wanted to support people with intellectual developmental disabilities, they said to do so. You know, dreams, wishes, and desires, you know, community inclusion, allow people to live in their own homes, supported employment, self-determination, all of those things. And we got on board with that. And the intellectual developmentally disabled people in our world were treated the same as those with mental illness. And we offered all of those opportunities. Our self-determination went from like 6 people to like 1,000 people are on self-determination now. We provided a lot of CLS services. And I don't believe that there was a transition from the old administration to the new administration. And so we submitted our encounter reporting month after month, year after year, and our CLS continued to go up, and nobody had any question about it. And then all of a sudden, they said, you know what we're going to do? We're going to remove the utilization factor as a, you know, prior utilization as a predictor of future utilization. And that's what they did. And, you know, the CFO come to me and said, John, that's worth $35 million. That's exactly what that's worth. And I think the culture here in Macomb County, if I can say, we're a very densely populated community, small, have world-class providers all over the place. You can go across the street and find a CLS worker. That's not true in, you know, Roscommon County. You may need CLS services, but to find a worker in remote areas of the state of Michigan, they didn't provide as much service. So I think one of the community factors that happened here is that a lot of people needed CLS. We determined it was medically necessary, and we had readily available providers. And that's what was really good about our system of care. And that's exactly what the Home and Community-Based Services waiver is all about. They removed that utilization factor, and that's where they took the $17 million. I don't think anybody had an idea of what that would happen. So to the question, do I think it would make a difference if we were with St. Clair County or not? No, they were still going to pull that $35 million from us on that premise. I think we had it right. You know, I have to say that. I think we had it right. And, you know, you have to fund it. You know, you want the ideal, you have to fund the ideal.
Are you through, Commissioner Saline? Yes, Commissioner Bush?
what you just said about, without saying Mike Head's name, John. So the 12, I'm looking at this, the Medicaid expense projection for 18-19. So it shows a $12.8 million deficit. Below that, what we don't have is the bottom half that we usually see is a requirement of 7.5 ISF, which is another 12 million. Is that right?
Yeah,
So that's 24 million.
yep. You have to, the first and foremost thing that we need to do is we need to close that revenue to expense gap. We have
Oh,
to do
sure.
we have to do that right now. And then we used to be in a better position to build ISF, Internal Services Fund. That's just hard to come by now.
No, I had that conversation
Yeah.
with you, that our situation is at the top of the page at first. But I just want to point out that the bottom of the page is missing is another $12 million that you show, 7.5 of that, Kathy did the math for me, I'm going to thank her and her calculator, is 12.5 million for an ISF.
Yep.
Okay, then my other thing is, what you just said about how we provided the level of service that we did for so many years and it was permissible. But when we had the meeting on 15 Mile to do cuts, when Jim did the presentation about the respite cuts, everyone was pretty distressed by it until the point where Jim showed graphs that showed what an outlier we were for other people in the state. And that makes it a little easier to understand cuts and what you have to do if you are an outlier in tough financial times. And that, I'm just commenting that these are tough financial times. So we at least have to be in line with the rest of the state. I'm not giving up that, I don't want to get political, but I saw a proposal from a candidate that her understanding of mental health was incredible, that mental health has been underfunded. So depending on what happens in the election, there might be people who will understand that and act as they can to rectify that. Which they have us like on a treadmill trying to figure this all out, and the issue is we're underfunded. So you can do it all you want and it's not gonna, look good. Thank you.
Any other commissioners? Commissioner Burdick?
There's no doubt that the state has been underfunding mental health for a very long time. The simplistic evaluation of the present situation of where we are is we're exactly where the State Department put us. Just put the $35 or $40 million that they cut back into the formula, and we don't have a single problem at all. They cut 35 and 40 million. They didn't cut a single consumer. The expectation was that we continue to provide services. That's nonsense. We're exactly where the State Department put us, and the people who put us there are no longer there. So that's part two of the problem. You put the money back in, it all goes away. If you add the underfunding, it goes away even more clearly. You're going to beat yourself to death if you don't look at the opportunity that John is indicating on the 29th. Somebody has to tell the folks who are now in charge of what the situation is and how it occurred. You can't cut $35 or $40 million in 1 year without reducing recipients, without an expectation of negative numbers occurring. And that's exactly what's happened. So I tell you, put 35 or 40 million back, the numbers all shift dramatically. Somebody has to tell the State Department that where we are is because of what they did. And getting out is dependent on their providing some of the remedy necessary, or you're going to have a very, very critical situation with consumers. I mean, it's just that clear. We're here because the state put us there. I think we need to tell the state that they need to belly up to the bar and provide the assistance to get us out of here. And that's the 29th of October, and I suggest that that ought to be the bottom line of the conversation, and we ought to make a record of that because we may need the record in the future.
So those are, exactly the ideas that I want to convey to the department too. So I'm going to put a pretty substantial document together that speaks to what's going on over the last 3 years. I'm not going to rewrite it all, but, I'd sent a letter to Tom Renwick back on, August 12th of 2015, and I still have it, and I told him what was going to happen. We've, cut, millions of units of CLS out of our network of care, and I'm going to show those statistics. And I'm going to show them, all the other efforts that we've made as a board and administration trying to do what we're charged to do, and to not, compromise our situation any further. So they're going to hear it, and I'll do it, politely, professionally so, and sternly so as well too. But my point is that they're all new players, and I don't think that they know about Macomb County, and so they need to hear about it. Yeah. Well, your appointed at-will folks will be new. You're right about that. But some of the administration who I sit with every, Thursday, the first Thursday of every month, they're all new faces. So that's the first thing we're going to do, that I'm going to do, is meet them on the 29th. I think we also need to, and we worked on the respite, we reduced the respite, okay, so that's moving along, so that's okay. Working with Chairman Vosberg, I think it's important for us to readily have some study sessions where Jim and some of the staff have some ideas where else we're going to go. I've seen a glimpse of it today. I haven't been part of that group, but I think Jim's been taking the lead and working with the staff to come up with additional ideas on, where we can get some savings, and so I'll defer to him when we get to those committee meetings to present that information and how quickly it's going to come before the board. But there was 4, 5, 6 items that I seen in this cheat sheet that I seen today. It was presented to me by the CFO. It has merit to it. So, my hat's off to Jim and the staff who are looking at this. But we need to have those work group meetings. And then, there's still that legislative option out there as well, too. Can we get the legislators to, still support us somehow? And whatever else is in the mix.
I will, but I looked at, when we see our expenses every month, there's ways we should get somebody cheaper, because there's a lot of people out there that are doing our services, but they're overcharging, I believe. That's what we should look at too. So, this is receive and file. Huh? There's already a motion. All in favor? Aye. And against? Motion carried. There's no resolutions, other possible agenda items. I want to thank everybody for coming out to Crossroads. I think John had a good send out from Crossroads. Did you not, John?
It was nice. Very nice, yeah. Thoughtful.
Yeah, and quite a few of the commissioners came.
If I missed something, aren't we going to select 3 meeting dates from the dates that went out?
It's not on my agenda.
We're going to the chair, we have a couple of things under other items if we can.
Yeah.
And Kathy, you want to lead on this, or me?
I can. In front of you, there should be a printed one-page document that just lists a bunch of dates in October
I
and
don't have
November.
Oh.
And what I think would be the most efficient right now is if we could just take a few minutes to go through this calendar, and I'm gonna ask you if you cannot meet on a certain, if you cannot meet, okay? And then we'll have staff go through our responses and try to pick the best date. And because we only have 7 of us here, we may need to make a few phone calls to do some polling by phone call. But the purpose of this discussion right now is to set up 3 work-study sessions where we can discuss and hear some of these proposals that John was referring to. So so what I'm going to do is, I'm going to start with October 29. Is there anybody who cannot meet on October 29? Okay. How about October, this meeting would be at 7:30, so is that a scheduled day that we have?
That's our interview day.
I didn't think, I thought I looked at all that.
Is the afternoon one from 12 to 3?
That's, oh, yes, it is, but it's that afternoon. Okay. So the question still holds, so just Linda's the only one that couldn't meet that morning at 7:30. How about Tuesday, November 30? Lou cannot meet on that day? Okay. And I'm gonna skip a few dates here. I'm gonna go to November 1. Is there anyone who cannot meet on November 1? Chris? And then Friday, November 2. Is there anyone who cannot meet?
I have a point to make about November 2nd. I think November 2nd needs to be removed as a meeting date possibility because Member Services Committee meets in Lansing on that date.
Okay,
I
so,
think they moved it to the 15th, Lou. I have it on my calendar twice, the 15th and the 2nd, so I think they moved it to the 15th, but I won't swear to that.
but it looks like it's gonna be removed.
November 15th is deer season. It
Okay.
would never be on the 15th.
All right. Let's stop. Looks like it won't be that day anyway, because a number of people raised their hands. So I've got Lou, Chris, and Joan.
I can't meet on any Friday.
Okay, all right, very good. How about Monday, the 5th?
You have all the, you need to ask people what days they can meet.
No, I'm going, they cannot meet.
I'm gone the 5th through the 13th out of town, so I can't meet any of those days.
Okay, Selena. I'm not, we're gonna have to have some of these meetings where people can't be present. I mean, not everyone will be present, but anyone, all right, so back to the 5th. Anyone else on the 5th? Chris, that you said you could not? Anyone else that could not? How about we'll go over to the 9th?
What happened to the 8th?
I said I'm skipping around a little bit. So the 9th, is there anyone who cannot on the 9th?
The 9th should be removed because that's steering committee in Lansing.
I cannot meet on a Friday.
Okay, plus Joan can't meet anyway. Okay, so we're just gonna cross, I won't even ask about Fridays. All right, and then, Tuesday, November 13. Selena cannot, is there anybody else? Chris cannot. Wednesday, November 14. Is there anyone who cannot on Wednesday, November 14?
Celine, are you back?
I'm back. I'm back on the 13th.
Okay. Then Monday, November 19. Is there anyone who cannot?
19th Monday.
Chris? Okay. Tuesday, November 20.
That's the day of the full board meeting.
That night?
Yeah.
Oh, yeah, right. That night we have full board. Okay. We've got Lou and Chris that cannot. All right. Okay, so I'm going to go back and pick up a couple of them that I had eliminated at first. So let's go back up to Wednesday, November 31.
October 31.
I'm sorry, October 31. Wednesday, October 31, top of the page.
And what's your question?
Can you, anyone who cannot meet on that day? Okay, so and I did not ask about Thursday, the following Thursday, the 8th. Selena cannot. Is there anyone else who cannot on Thursday, the 8th?
CAC will be in that room at 9, so we have to get out.
On the 8th?
Or move somebody, but on the 8th.
Okay, or maybe we can meet at in a different location. Okay, thanks for pointing that out. Then we have that whole last week of November, 26, 27, 28, 29. So who cannot meet on Monday, the 26th?
What date?
Monday, November 26th. Chris, I got you.
I cannot meet on the 26th.
Okay. Tuesday, November 27. Chris? Anyone else? Wednesday, November 28,
How long are these meetings?
hour and a half,
Oh, okay,
maybe 2,
okay.
maybe 3.
Sheesh.
And then Thursday, November 29. Anyone who cannot? Okay, that's a help. We'll have to, I think we'll need to poll a few of the other members who aren't here tonight, but that will give us a starting point anyway. So thank you. And that's all I have, Madam Chair.
Do I have to take a vote on that?
We're not going to select the date tonight, so.
Commissioner
I have a
Bush?
question on something that came up while we were doing that, so I need clarification from Barb. So full board is not on the 28th, it's on the 20th?
It's on November the 20th,
November, okay,
before Thanksgiving.
thank you. Less than a week after the program and budget.
Yeah.
Okay.
November 1.
Tuesday.
Back, I don't mean to step in here, but back, are you done with this item? Back to the,
Are you done?
Yes, I
Yeah.
said I was, yes.
and back to the chair, with your permission, I have one other item I want to just briefly talk about. A month or two ago, I explained to the board, you know, you have the Michigan Association of Community Mental Health Boards, right? We all belong to that. There's also the Michigan Consortium for Healthcare Excellence, MCHE, right? Those are the PIHP folks that hang out together. And I told you there would be some added cost that'll be borne to this board relative to statewide initiatives and being in partnership with MCHE. So we paid a recent invoice, you know, maybe $135 or so for some liability insurance, our share of liability insurance. There's a Michigan Department of Corrections initiative that's being worked on with the PIHPs, and we're bearing a little bit of money relative to supporting a state liaison, so we're making those payments. They're small, $1,300 payments. I have to do it 6 times, so it's about $8,000 to us. Next time we meet, I'm not going to be here. I'm going to stay up in Traverse City the next couple days on my own dime. But the next time we meet, on the agenda is going to be, I expect to be on the agenda, I don't know that for certain yet. On the agenda is a memorandum of understanding that I'm going to ask the board for approval and understanding. I'm going to sign it. I usually do sign MOUs that I'll refer people to CARE. People from CARE will refer people to me. There's no monies involved. I don't have a responsibility or financial or an obligation to have board approval on those MOUs because there's no monies. This particular MOU is a little bit stiffer, and it commits us to $67,000 a year for the next 3 years to support the mental health parity initiative that's going on statewide. And this is another one of those unfunded mandates. So when you're up to the department and you get a chance to see somebody, Bob Sheehan, ask them what's going on with all the unfunded mandates. Because now we're going to pick up, $250,000 to do what is needed in mental health parity, and they're not going to fund us for it. but I want the board to know, and Jim will present it on the 24th. It's an MOU, again, if it's ready. An MOU between Macomb and MCHE, Michigan Consortium for Healthcare Excellence, who MCHE is going to sign a contract with the vendor who is going to deliver the software product for us to be able to do level of care determination for consumers who need psych inpatient. So not only what we're going to use here in Macomb County, it's going to be used throughout the whole state of Michigan. And we'll write it all up. Maybe I'll give it to you in a Friday update so you can get another opportunity to be exposed to it. But I strongly encourage you, if the legality, Kimberly's working on it with Aaron Thomas, if it all works out, then I strongly encourage the board to go ahead with the signature on the MOU, and then knowingly that we're going to get in line with the other PIHPs relative to the mental health parity initiative. So it's just kind of like a heads up, okay? That's all I have tonight. Thank you.
I want to say that we have 2 tickets, the Red Wings tickets, donated by Commissioner Salina, and we have a blanket made with the Red Wings patterns and everything to give up at Travis for the PAX auction. So thanks, all you people that gave me $5. I don't know, I got a couple more to collect from. I'm sure. But Dr. paid, Dr. Gross and Nick were the first ones this year. Thank you. Is there any other agenda items? Seeing none, meeting adjourned. Oh, hearing of the public. I'm sorry. I don't see any public. Meeting adjourned.